Hello everybody, this is me, Dr. Piyush. I'm a physiotherapist here and I have come up with a video and I'm going to teach you about self-management of neck pain and the radiating pain in the arm. So without wasting any more time, let's start the video. Okay, so what are the normal conditions we see in the neck? Okay, there can be a locking of the neck, like you have slept for a while and once you wake up after a sleep, you feel that you're not able to move your neck. So that is a locking of the neck. That's a mechanical issue. Okay, and there can be a spasm buildup because of your previous and older neck issues. So okay, so how are you going to treat that? Okay, for when you are having a tightness in the muscle, so the basic goal is to relax those muscles. Okay, so what is the best self technique to relax those muscles? Okay, so we're gonna discuss the self technique that is called the PRE. The full form of the PRE is a progressive relaxation exercise. Okay, this is a relaxation method which can be done by a person or individual by himself. Okay, so this can be done in a lying position, or it can be done in a sitting, or it can be done in the standing position as well. So how you can perform this, let's start the video. Okay, for somebody with a neck issue, you can start doing with your shoulder movements first. So what you're gonna do is you're gonna lift your shoulders up and you need to tighten up your shoulder muscles. Then you hold that for a count of 5, like 1, 2, 3, 4, and 5. And then you just slowly bring it back down. And then again you lift it back, 1, 2, 3, 4, 5. So by doing this, you are actually tightening and then relaxing. So it actually what it does. The basic effect of this exercise is going to make the muscle more relaxed. That is going to be the outcome of this exercise. Okay. Once you do the 3 movements of the shoulder, then you need to do for the neck muscles. How you do that? Okay. So we're gonna work it on the side muscles of the neck. Okay, so we are working on this muscle. So you just place your hand on the side of your head and you're pushing on the opposite side with your hand. So you just push it there and you try to push your head against your hand. So you do it for a count of 5, like 1, 2, 3, 4, 5, and just relax. Okay, then again you repeat it, 1, 2, 3, 4, 5. Okay, you do it for 3 times here. Then you do it from the another side the same way, 1, 2, 3, 4, 5. Okay, then relax. Then you keep your hand back again and you do the same contraction, 1, 2, 3, 4, 5. Okay, after doing this 2 movements, you're gonna do the back muscles of the neck. So what we're gonna do, you just keep your hand like this and you're gonna push it forward. Okay, so we are pushing our neck forward and we are trying to push the neck backward against our hand. So you do it like this, 1, 2, 3, 4, 5, and you just relax, 1, 2, 3, 4, 5. Okay, so these are the progressive relaxation exercise, or you can say the mix of isometers. This is going to help you make muscle relax. Okay, what you can do following after this? Okay, once you have done this basic exercise for the neck, you should do the Rmm exercise. That is the range of motion exercise. So let me teach you how to do this. Okay, and this what you do, you just perform the gentle movements of the neck, like you are trying to move your neck to the right. Okay, this should be at a uniform speed and it should be slow, and you try to hold the neck at the last available range. Suppose you're able to take your neck to this range, you should try to hold it over here, and then you come back to your neutral position, and then you repeat the same thing on the other angle. So you gently take your neck to the left. Okay, and you try to remain at the last available range where you feel there's a restriction. So you remain there for a count of 5. You count 1, 2, 3, 4, 5, and then you return back to your normal position. Okay, so you do these movements like twice for both sides. Okay, you hold it for 5 counts, and then you come back to the neutral position, and then you repeat it on the left side again, 1, 2, 3, 4, 5. Okay. After this, what you need to do is you need to have the side flexion. You just take your neck like this you're trying to touch your ear with your shoulder. So, and you are, you give a stretch at the last possible range. Suppose this is the maximum range you can touch. So you just be there for a count of 5, then you come back to normal neutral position, then you take your neck to the left side again, right? You count for a 5, count of 5, 1, 2, 3, 4, 5. Okay, so you have performed the neck motions in 2 directions. Then what we're gonna do is we're gonna do the this thing. You're gonna take your neck like this forward, 1, 2, 3, 4, 5, and then you come back in the neutral position and you take your neck back, 1, 2, 3, 4, 5. Okay, so you even repeat it twice. So this movement. So these are the set of neck exercise program which you can do it yourself at home in the initial stage when you have this kind of problem. Okay, so and how much time one could do it, like these exercises can be repeated like every hourly for 5 to 6 times, and then you can see a difference in your neck pain. If it's not helping you, you may need to seek an advice of a specialist in this case. Okay, the next condition which I'm going to discuss now is the radiating pain which is coming from your neck or your shoulder and which is traveling to your arm or the fingers. Okay, so there's a similar symptoms in this condition also. When there's a radiating pain, obviously there's a muscle tightness or there's a buildup of spasm in your arm. So how you can treat the symptoms of this condition by yourself. Okay, so we're gonna use the same principle of PR in isometrics. So we're gonna do a contraction relaxation method again here. So suppose you can see my hand, right? You can just keep it like this. Okay, you need to tighten your hand, hand like this. Okay, you do it for a count of 5, 1, 2, 3, 4, 5, and then you gradually open up. Okay, then you repeat back again, 1, 2, 3, 4, 5, and then you gradually open up. So you do for a couple of 3 times. You repeat this hand movement. Then what we're gonna do is we're gonna perform the movement in the elbow joint, because elbow joint is a very special joint because your muscles are going through the major muscles, right? Your biceps is there, then your forearm muscles are there, which is like is a major part of your arm. So we're gonna work on this. How you do that? You need to flex your arm like this, and you tighten up your elbow like this. So, and you do it for a count of 5, 1, 2, 3, 4, 5, and you just relax gradually. Then you repeat back again, 1, 2, 3, 4, 5. So you do the same for the 3 times. Okay, then another movement which you should be doing in the case of radiating is you taking your arm backward. Okay, how we do is we take our arm a little back at the last possible range, but make sure your torso is straight. You should not move this part of the body. So you just keep your arm at the back and do it for a 5, 1, 2, 3, 4, 5, and gradually come back to neutral position. Now repeating the same way, 1, 2, 3, 4, 5. Okay, so you're doing this for 3 times, right? Okay, the next movement which should be done is you taking the arm on the towards the ceiling. Okay, you try to make as much straight as possible with you. So you just do this like 1, 2, 3, 4, 5. Okay, gradually drop down back, and again we're doing it 1, 2, 3, 4, 5. So you do it for 3 repetitions for this. Okay, so these are the basic exercise you can try for the radiating pain condition. And I hope this exercise works for most of the patient. In case and the same applies for this exercise also. You can do it for 5 to 6 times. You can have a break of 1 hour. Okay, so in case it doesn't help, you have to seek the advice of an expert in this case. So thank you for being with my video. I'll see you in the next video. Bye bye.